Good morning and welcome, sir.
Good morning, Krishna. Good morning.
Good morning and welcome to all. Very much thanks to Padma Bhushan Dr. Nageswar Reddy garu to accept to inaugurate our new equipment in the gastroenterology department in Bhimavaram Hospital. Sir, you, G.V. Rao garu, Gopal Raj garu are the mentors for us to give good quality treatment using good investigative modality. Again, thank you, sir. Now, request Dr. Gopal Raj garu, our chairman, to speak a few.
Morning, sir. We are very happy that these instruments are being inaugurated virtually by a skillful international figure like you. That we are very much thankful to you and Dr. G.V. Rao garu for constant encouragement for the upgrading of the Department of Gastroenterology in Bhimavaram. Now we are happy to have a fibro scan and Olympus 190 system of endoscopies which is available in Bhimavaram, in the surroundings. It is only in Vijayawada and Rajahmundry and Vizag. So we are once again thankful to Padma Shri, Padma Bhushan, and B.C. Roy awardee and international figure Dr. Nageswar Reddy garu for inaugurating these scans virtually. Thank you very much, sir.
Sir, please inaugurate our new equipment and give your valuable message, sir.
Thank you very much, Krishna garu and Gopal Raj garu. In fact, my association with the Bhimavaram hospitals has been for a very long time. And when Krishna Raju suggested this, I in fact wanted to be physically there, but because of certain constraints, I couldn't come. But I think virtual inauguration is now as good because you can see that we have a very good attachment there, and you can see the picture very clearly. Bhimavaram Hospitals, I think, has been an example of how you can build a truly world-class hospital in a semi-urban or in near rural area, equip it with very good equipment and practice world-class medicine. Of course, Gopal Rajgar has always been an inspiration for all of us, how he has such deep clinical sense and how he's practicing dedicatedly, and so much of patient trust is given to him. Similarly, Krishna Raju, for very long we have been associated. In fact, Krishna Raju was in our endoscope unit for some time earlier on before he went back to start the Bhimavaram hospitals. In fact, we very much wanted to retain him in AAG, but of course, he has gone for a greater cause there to Bhimavaram. And I've seen the growth of Bhimavaram hospitals over the last few years, and they have shown a tremendous growth. So I'm glad that these two new equipments are being added. Again, like it has been mentioned earlier, these two are very expensive equipment, so they're not available in most of the places all over, even in southern India, very few places are there. So let me start first with the first equipment, and that is the So this 190 system Olympus, I think, is the latest technology with the narrowband imaging. The NBI means narrowband imaging. This is extremely good in diagnosing early gastric and colonic cancers. And you can see here the equipment is very slick. It has got a very high definition, magnification. And again, even in gastroenterology centers in the country, very few have this even gastro because of the cost involved. Few centers which are having very high corporate hospitals have some of them in the country, but very few centers have this kind of equipment because of the cost. I'm sure with this, you'll add a lot of diagnostic value to all the patients coming to the gastroenterology department. I'm sure this will be utilized in a very proper way. And what will this do is not only increase your diagnostic capacity, but also increase your therapeutic capability, because you can now diagnose early gastric cancers, early colon cancers, which we are seeing now, and very good resection, endoscopic resection of these cancers, including polypectomies, can then be done very safely. The other advantage of this system is that it's got a water jet in it. Because of the water jet, as you're doing the surgery, you can actually inject high pressure water, stop bleeds, look at the bleeds, or wash the area completely, like a surgeon would do. All this is possible because of this 190 Olympus system, which has got an extremely good view, therapeutic capabilities, and because of the use of this system, I think earlier it was mentioned, very few centers in South India also have this system. And because of the availability there, I'm sure it will add a lot of value to gastroenterology patients. So I'm extremely glad that you acquired this system, and I'm sure that it will add a lot of value to what is going to come. So this is the first one that is going to be inaugurated in the gastroenterology department. The next system we have is going to be another very interesting addition to diagnostics. Fibroscan. Again, fibroscan will explain the concept. And what is a fibroscan? Fibroscan is this type of scanning which will tell you what you have in the liver. For example, they can be liver fat, they can be liver fibrosis. And nowadays we are seeing a lot of non-alcoholic fatty liver disease. Up to 30% of the population has. So normally with the ultrasound scan, we can say that this patient has fatty liver. That's all. And we stage 1, stage 2, stage 3. But with fibroscan, you can say that this patient has fatty liver. We can stage the fatty liver into categories S1, S2, S3. That means 300 degrees, 280, like exact figures of fat we can give. And also we can stage the fibrosis in the liver, F1 to F4. If, for example, if patient has F3 or F4 fibrosis, that means advanced stage of fibrosis going into cirrhosis. If it is in F0 or F1, that means early stages. And in this patient, if you take proper precautions, including diet, exercise, and medications which are now available selectively for this, you can reverse the whole thing. So F0, F1 can be reversed completely. So this is the importance of fibroscan. And I'm extremely glad that Bhimavaram hospitals is actually putting in so much money to get this technology, because this technology, again, very few centers have. I'm sure in Andhra Pradesh it will be the first one, and very few centers have this type of technology because of the cost. And with the expertise available in Bhimavaram Hospital, with this type of technology, I think patients with fatty liver disease can very safely be treated, very scientifically and accurately, and it will benefit the community a lot. So I think I'm extremely glad again that both these technologies, especially fibroscan, which is such a high-end technology, is being introduced in Bhimavaram hospitals in that area. It will be a big boon to patients having all types of liver disease. And I'd like to again congratulate both Krishna Raju and Dr. Gopal Raju and the gastroenterology department, Dr. Valma and others who have been responsible for getting all these technologies. And I'm sure this will be a new era in the treatment of gastrointestinal disease in Bhimavaram and surrounding areas, because this is such a technology that will cater not only to Bhimavaram, but all the surrounding areas, because this is something which can be useful for all the people. I'm sure the people will take advantage of this technology, and they will be able to actually use this in a proper way, so that it will benefit the treatment of the patients. Once again, I'd like to thank Dr. Krishna Raju for giving me this opportunity to take part in this very important inauguration program of 2 very advanced technologies that are being introduced there. Thank you, Krishna Raju.
Thank you, sir. Thank you very much, sir.